Hi, and welcome to Carolina Women. We are here today at Bluffton Aesthetics with our friend Sheree, and we're talking about something that's really interesting and I'm curious about too. I think all of us are, and that is non-invasive body sculpting. So let's talk a little bit about what that really is.
So non-invasive body contouring and sculpting is when you take a device that's non-invasive and you destroy the fat cells permanently and they're eliminated. So once the fat cells are gone, they're gone forever.
So what do you all do, and what kind of gadgets, I guess, do you have to do it with?
So we have two gadgets, actually. You like to call them gadgets. It's fun. We have the Emsculpt Neo, which is Tesla technology.
Not a gadget then. Tesla
not
technology.
A gadget. It actually is pretty legit. Both of our devices are FDA cleared. This one is actually pretty remarkable because it does muscle and fat.
Okay.
It does up to 30% fat loss in 6 treatments, but they just got FDA cleared for visceral fat. So we have subcutaneous and visceral fat, and even liposuction, you can't get the visceral fat. That's the fat below the muscle.
So talk to me, if you will, about what the difference is between contouring, sculpting, and then eliminating fat. Am I reshaping? Am I actually eliminating?
You're doing both.
Okay.
So we choose whatever the patient's goal is. So some people may need additional treatments depending on their goal. The other body contouring device we have is called the TrueSculpt ID, which uses radio frequency to tighten the skin. So it's one of the few devices that actually tighten skin, which we all need.
Yeah, absolutely.
And it gets up to 24% fat with one treatment.
Oh, interesting.
So it uses heat to kill the fat. So when you heat fat up to 44 degrees Celsius, it dies.
Who are good candidates for these?
The perfect candidate for these devices is someone who struggles, any age group really. I do all age groups. And someone who struggles for that fat, the flanks, the areas that we work out, we struggle. You know, someone who's using it to lose weight is not a really ideal candidate.
Okay.
It's, you know, not that it won't work, it will. But it's more people that are more proactive in their health, proactive in their routines, and just have that just stubborn, you know, I do bra fat area. You can pretty much do any area.
Do you do as many men as women?
Oh, absolutely,
yeah. I wondered about that. That makes a lot of sense. If I'm getting ready to make a decision, if I want to come in, which machine I want to use, what I want to do, how do I make that decision? Do you come in and give me a consultation? Do you actually take a look? I mean, I may say I want this and you'll go, no, maybe this is better.
No, I always focus on what the patient bothers them. You know, I'm not one of those people who point out flaws at all. I usually focus on what the patient is concerned about and give them their best option or multiple options. We combine these devices. So if say someone has abdominal fat, I will do the Neo first, and then we'll follow up with the ID, or do the ID first and follow up with the Neo. Sorry about that. And then they can do multiple treatments after they get additional fat, plus to get that core strengthening. Because when you have that core strengthening, you're going to burn more fat. Is there
an educational component to doing this so that everyone's kind of sets expectations and you know what to expect and what you're going to get?
Well, pre and post photos don't hurt. But metabolism does, you know, some people metabolize fat. That's why we say up to 30%, because everybody metabolizes fat differently. But really, the only prep with these devices is to be hydrated. There's no bruising, no swelling, absolutely no downtime. But it takes up to 3 months to see the final result because your body has to process that fat out.
Now I know, go ahead.
No, yeah, so the final result is in 3 months. Some people do see it quite a bit sooner. But to have that final, this is my final result is at the 3-month mark.
And then you can also advise us, I don't want to call them packages, but how many actual procedures are going to be recommended for what my goal is.
Yeah, so the Emsculpt Neo is 6 treatments right out of the gate because it's doing muscle as well.
Got it.
So that one does muscle and fat. So it destroys the fat in slower increments than the TrueSculpt ID. It gets up to 24% with one 15-minute treatment, where this one is breaking it down slowly because we're also doing muscle.
I tell you what, every single time we talk, I learn something new, and I get excited about it. You've got a lot of cutting-edge, state-of-the-art things that you do here. It's pretty exciting.
Yes.
Thank you for joining us. Stay with us. More to come here on Carolina Women.